Welcome, clinical chemistry colleagues across Canada. Today we have a talk about quality from a quality person, Dr. Lynn Allen, who I've known for many years, not to date us, but likely before some of the audience were even born. Dr. Lynn Allen is going to be talking to us about laboratory quality management standards and the role of laboratory accreditation in improving quality. And before I begin, I'll just give you a brief intro about Lynn. She's the lab director at Headwaters Healthcare Centre in Orangeville, Ontario, and her main interest is in actual quality management. She has conducted workshops on implementing Ontario laboratory accreditation requirements in 2003 and 2004, as well as conducted numerous workshops on measurement uncertainty. She is chair of the IQMH, formerly called QMPLS. Now, if you can remember all what those mnemonics stand for, those things stand for, I can't remember. And she's the chair of the IQMH Chemistry Committee. She's a member of the CSA Z252 Medical Laboratory Quality Systems Committee, and she has presented on the role of quality management systems in improving patient safety and laboratory aspects of that in the CSCC Symposium on Patient Safety several years ago, and published in Clinical Biochemistry on the same topic. She's the chair of the CSCC Working Group on Quality Management. So with that, I will turn over the stage to Lynn to start her presentation. And remember, the lines are muted. At the end, the lines will be unmuted, and you will have to press *7 if you want to have verbal questions. But remember, the chat line is available. You can actually type in your questions. And I'll tell you at the beginning, I'm the moderator of this meeting, but I'm hampered by the fact that I could not download the software for ReadyTalk to function as a proper moderator. So Lynn is going to have to be addressing, she will be able to see the chat questions, and we'll be addressing those as well. So let us begin. So Lynn, please proceed.
Thank you very much, Morris, and welcome to this Education Roundtable. This talk describes some of the basic aspects of quality management systems, and it supports the module Laboratory Quality Management Standards, which is part of the CSCC Leadership in Quality Management Certificate Program, which is being developed by the Working Group on Quality Management within the CSCC. And this program, it is intended, will be launched later in 2015. We are planning to have one module as a demo at the CSCC meeting in Montreal. So the learning objectives for this talk are to talk about sources of laboratory quality management requirements, to talk about the role of laboratory accreditation in improving quality, and also to describe the importance of document control in maintaining quality. I have nothing to disclose as per the CSCC policy. So the first part is sources of laboratory quality management standards. And these are standards for accreditation. So here we have a table that summarizes this part of the talk. So at the top of the hierarchy, we have international standards organizations, and the two main ones that we're talking about are the International Organization for Standardization, or ISO, and the International Electrotechnical Commission, IEC. Now, you may wonder what that has to do with this, but it will become clear in a little bit. There's also national standards bodies that come under the international standards organizations. Each country has one of these. In Canada, the Standards Council of Canada, or SSCC, is our national standards body. And in the U.S., it's the American National Standards Institute, or ANSI. And these are names that I'm sure you have heard of. So under these come standards development organizations. And these are ones that are relevant to the lab world. We'll be talking more about each of these. But in Canada, there's the Canadian Standards Association, and there's the BNQ, which, while it does develop standards, it does not develop laboratory standards, but it has a role in accreditation. And in the United States, 3 of the key ones are CLSI, CAP, and the NIST. We'll talk a little bit more about these. Then things that are regulatory in terms of sources of requirements for standards are federal and provincial statutes and regulatory bodies that come under such statutes. Then we have scientific and professional organizations that develop standards and guidelines. These may be societies or non-regulatory bodies. And then we have publications, consensus documents. So in terms of ISO and IEC, we have a number of standards from ISO that most of us should be familiar with. We have ISO 9001, which does not really pertain to our labs. However, the standard ISO 15189 comes under ISO 9001 in terms of it being a more detailed quality management standard for clinical laboratories. We have ISO 15190, a safety standard, 22870, point of care, and this is a technical specifications, not a standard, 22367, which is talking about risk error reduction through risk management. And so in terms of ISO IEC, these standards are important in terms of laboratories, but they play a slightly different role. This standard talks about competence of testing and calibration labs. This one about requirements for proficiency testing, so that groups that do proficiency testing may be accredited to that standard. Groups that do accreditation, if they're accrediting to 15189, are accredited to 17011 and sign a mutual recognition agreement for that. And then we have a IEC guide, ISO IEC guide, which provides information on 4 proficiency testing programs about how to adopt schemes for this. So the national standards body, in summary, for Canada, we have the Standards Council of Canada. It's our national standards body. It accredits standards development organizations, and it also accredits organizations itself. And then we have ANSI, which is the national standards body for the U.S., and it accredits many standards development organizations in the U.S. So in Canada, the Standards Council of Canada accredits standards development organizations. These are all of the standards development organizations that are accredited in Canada. The Canadian Standards Association is relevant to us in terms of laboratory standards, and this one, BNQ, develops standards but not lab standards. So some examples of standards that the CSA has developed are standard on respirators, fume hoods, sharps containers. This is a new standard on sample collection facilities, which has been available since 2012. Handling waste, pressure vessels. This one is sort of tangentially related, but this has to do with autoclaves. And then an important one is the blood and blood components, Z902. Also, Canada is world famous for its CSA electrical standards. In the United States, there's numerous standards development organizations that are accredited by ANSI. And as I mentioned, a few of them are CLSI, CAP, and NIST. I don't expect you to be able to read this slide, but on the left side we have the Quality Management Series standards, and on the right we have the EP standards, and there are many other technical standards that are that they develop and that we use in our laboratories. And the College of American Pathologists develops standards as well as having a big role in accrediting labs. And here are some of the standards that have been developed by the CAP in terms of pathology. So, and here we have a diagram that shows a summary relationship of all of these bodies. So ISO-IEC at the top, the national standards bodies for our two countries, and standards development organizations. So here, so the standards that we've been talking about so far are voluntary standards. Some of them have been adopted by the Standards Council of Canada as Canadian standards. For them to be requirements for our laboratories, they have to be adopted by ministries of health in our various provinces or possibly other regulatory bodies. And so they are all voluntary. So provinces that have adopted those standards are several. There's Ontario and Newfoundland and New Brunswick. So the standards that we're going to talk about now are federal statutes. And these are regulatory, and so we do have to abide by these. Here are some of the ones that affect laboratories: the Criminal Code of Canada, Canadian Labour Code, Human Pathogens and Toxins Act, Nuclear Safety Standards, and Transportation of Dangerous Goods. And a very important guideline that comes out of the federal government and the Public Health Agency is the Canadian Biosafety Standards and Guidelines, which impact all of us, but in particularly our microbiology laboratories. Provincially in Ontario, here are some examples of Ontario regulations. Other provinces may have analogous kinds of acts and regulations. We have the Environmental Protection Act with a regulation on waste management, the Fire Protection and Prevention Act, Healthcare Consent, Promotion and Protection. This has to do with communicable disease regulation. Laboratory and Specimen Collection Center Licensing Act. This is the act under which our laboratories in Ontario are licensed. Occupational health and safety, everybody has some sort of act like that. And there's several others here. In New Brunswick, there's the Fire Prevention Act, Occupational Health and Safety Act, and Personal Health Information Privacy and Access Act. And there's probably a number of others, but here's a couple of examples. And we have standards and guidelines, standards for med lab services in New Brunswick. And then in Newfoundland, there's the Occupational Health and Safety Act. And again, there's probably quite a number of others, but these are just a couple of examples. So colleges are under provincial legislation, so they are generally regulatory bodies. Some of these are mandated to provide proficiency testing and accreditation programs, and that is true of the first three colleges of British Columbia, Alberta, and Manitoba. In Ontario, it's a little bit different. Our requirements for proficiency in testing and accreditation are based on an agreement or contract between the Ontario Medical Association and our Ministry of Health. Ontario is in the special circumstance of having a College of Medical Laboratory Technologists, and they develop a number of guidelines on which, which contribute to standards requirements in Ontario. And then in Quebec, for example, we have the Professional Order of Medical Technologists of Quebec and the Order of Chemists of Quebec, both of which groups produce standard kinds of documents. Then we come to scientific and professional organizations, and all of these groups and societies produce guidelines of one kind or another that become part of regulatory standards. So the CSMLS we're very well known for its lab safety manual, the CSMLS guidelines. The Canadian Society for Transfusion Medicine produces standards for hospital transfusion services. The Canadian Society of Cytopathology produces guidelines for cytopathology technologists. The Canadian College of Medical Geneticists produces practice guidelines for cytogenetics analysis. This is pertaining to cancer specimens. The Ontario Association of Medical Laboratories, which is an association of the community laboratories, produces a number of guidelines that provide really useful information. This is what the community labs do: retention of lab records and materials, guidelines for rejection of specimens, guidelines for reporting lab test results. These provide useful information for laboratories who are looking for such information, but also inform standards documents. And then also the American College of Medical Geneticists has guidelines on clinical genetics laboratories that can come into standards in Canada. And then finally, we talk about consensus documents, and here are two consensus documents that essentially we've adopted in our labs, probably all of our laboratories. The what we call the diabetes guidelines and the lipid guidelines. So these are all standard documents that support the standards that we use and come into our accreditation requirements. So I want to move on now to the role of laboratory accreditation in improving quality. So first of all, I would like to distinguish between certification and accreditation. This is something that is very confusing to people. The definition of certification is procedure whereby a third party gives written assurance that a product, process, or service conforms to specific requirements. So this is certification. You're certified to ISO 9001. This addresses only the quality management system aspects, so procedures, quality manual, document control, addressing nonconformities, performing internal audits, having processes for corrective action and preventive action. But it doesn't address any technical aspects of the organization, nor does it assess analytical competence, that is, that the people in the company are doing things properly. It just supports that all of this documentation in place and there are records that support the documentation. Accreditation is a little bit different. It's a procedure by which an authoritative body gives formal recognition that the body or person, so the laboratory, is competent to carry out specific tasks. So that's competence for our lab staff to do the work that they do on a day-to-day basis. It requires demonstration of technical competence. There's all kinds of technical requirements, which I will show you on the, I think it's the next slide. Personnel training, validation of instruments and methods, internal and external quality assurance. And it assesses the ability of the lab to collect specimens and perform testing according to the accreditation requirements. It also provides formal recognition of this competence. There's 5 other standards here, or standards and the technical specification, that are important to our laboratories. So we've mentioned ISO 9001, which focuses on a quality management system meeting customer needs. ISO 15189, which is the predominant standard that we use for our laboratory accreditation, is based on ISO 9001, but it also includes the quality management system and technical requirements. This has been adopted by the Standards Council of Canada as a Canadian national standard for the clinical laboratory accreditation. But as I mentioned before, such a standard needs to be adopted by provincial governments for it to become a standard in each province. And while this supports accreditation in many provinces, it's not necessarily adopted as a standard in all the provinces. ISO 15190 is the safety standard. It's sort of a partner to the 15189 and provides a framework for safety requirements in the laboratory. And ISO 22870, the point of care standard, again, it's a companion to ISO 15189. It specifies the point of care requirements in a hospital, clinic, and by a healthcare organization providing ambulatory care. That's quoting from the standard. And it depends on having the requirements of ISO 15189 in place as well. And then we mentioned ISO Technical Specification 22367, which is reduction of error through risk management and continual improvement. And this introduces risk management into the quality management system of the laboratory. This is becoming increasingly important in terms of aspects of the quality management system. So here are the management requirements of ISO 15189, and here are the technical requirements. So in a way, these would be the kinds of requirements that are in 9001, ISO 9001, although some of these are specific to the laboratory, like advisory services. But the technical requirements are not in ISO 9001. And so that's the big difference between the two. As well, we have to be able to demonstrate training and competence of our staff to carry out their tasks in ISO 15189. So we mentioned earlier these various standards. How do they relate to labs in Canada? So ISO IEC 17043 is the conformity assessment standard for proficiency testing. So essentially, proficiency testing providers that wanted to be accredited to this high level need to meet the requirements of ISO 17043. It specifies the requirements for development and operating proficiency testing schemes. A2LA, or the American Association for Laboratory Accreditation, accredits bodies to this standard. And as an example, IQMH in Ontario, IQMH being, as Morris said, the new name for QMPLS, is accredited to A2LA to perform proficiency testing. ISO IEC 17011 is a conformity assessment standard for accreditation bodies that are accrediting conformity assessment bodies. That sounds very convoluted. So it specifies the requirements for accreditation bodies that are going to assess and accredit these bodies, but it's also appropriate as a requirements document for peer evaluation process for mutual recognition arrangements between accreditation bodies. So what that means is that its requirements are the requirements that a body needs to meet to perform accreditation to ISO 15189 in its own right. So here we have two other international bodies, the Asia Pacific Laboratory Accreditation Cooperative, APLAC, and the International Laboratory Accreditation Cooperation, ILAC, which are groups that foster harmonization of lab accreditation practices to ISO standards. And their being signatory to their mutual recognition agreement allows these bodies to accredit labs. So what this really means is, and the example is that IQMH is now a signatory to APLAC and ILAC, so to these two bodies, and it meets all the requirements of ISO 17011. And so it can now accredit laboratories in its own right. It doesn't need to work with any other body to do this. Another standard, ISO 17025, which is a much older standard than ISO 15189, is a standard for meeting requirements for competence of testing and calibration laboratories. And so this is used as a standard to accredit environmental labs and testing labs. It is not so appropriate for clinical laboratories, and that's why ISO 15189 was developed, because it really is looking at individual tests, and we have such a multitude of tests that it doesn't really fit for our kind of environment. So this would be used, say, for water testing labs that have a limited repertoire of tests, or a lab that was calibrating devices, so perhaps calibrating thermometers or other kinds of meters. Then we have two other standards that are very relevant to lab medicine in Canada. I mentioned before the CSA standard Z902, blood and blood components. This was developed with transfusion medicine experts, government stakeholders in response to the Crever report. And it aims at maintaining and enhancing the quality of safety of blood collection, processing, and transfusion. And this is a standard that underpins accreditation requirements in quite a number of our provinces in Canada. Of course, this is looking at transfusion medicine more than the clinical chemistry, but nonetheless it's an important standard. And the new standard that I mentioned was adopted in 2012 is primary sample collection facilities and medical laboratories. This highlights include a focus on patient safety, quality of care, patient communication, ethics and privacy, infection prevention and control, and collection precautions. And this is a standard that if it's not already part of your accreditation requirements in provinces that have accreditation requirements, it may become more important in the future. It currently is involved in the IQMH accreditation requirements. So accreditation by IQMH. So proficiency testing is mandatory in Ontario, and there are voluntary participants to the IQMH proficiency testing programs in Newfoundland and in New Brunswick. Accreditation is mandated in all three of these provinces. These come out of previous histories of problems in some of these provinces, and the government mandated accreditation to IQMH as being a requirement. The IQMH accreditation is to ISO 15189 plus, as IQMH markets this, and the standards are based on quite a number of requirements: 15189, 15190, the safety standard, point of care, the blood and blood components, and the primary sample collection. In Ontario, the laboratories may choose to receive certificates of accreditation to the Ontario requirements or to ISO 15189. The accreditation to ISO 15189 involves an extra visit at the 2-year point in the accreditation cycle, whereas New Brunswick and Newfoundland receive certificates of accreditation to ISO 15189, and so they have to have that intermediate visit. I believe Newfoundland actually has a visit every year because their provincial government has mandated that. Accreditation by other bodies. In British Columbia, there's the Diagnostic Accreditation Program, DAP, which is mandated under the Health Professions Act, College of Physicians and Surgeons of British Columbia. And ISO 15189 is the source of its quality management requirements. ISO 15189 is recognized as a source of standards, quality management requirements in Alberta, Saskatchewan, and Manitoba. In Quebec, ISO 15189 is the basis of provincial accreditation through Accreditation Canada. However, Accreditation Canada does not accredit to ISO 15189. It accredits to its own Accreditation Canada standards, which are essentially a checklist, and it's a step on the way to accreditation to 15189, but it's not full accreditation. They do not have the ability to accredit to 15189. On the other hand, community laboratories in Quebec, or some of them, are accredited to ISO 15189 by the Standards Council of Canada in partnership with BNQ. So BNQ does the accreditation visits and recommends to Standards Council of Canada that all of the requirements are met, and the Standards Council of Canada issues the accreditation certificate. This, in fact, used to be the situation in Ontario with IQMH, or rather with QMPLS, its predecessor, before IQMH was able to sign the signatory to the MRA and do accreditation in its own right. Other bodies that accredit laboratories, well, the Standards Council of Canada can accredit laboratories to ISO 15189 in its own right, and as I mentioned, Accreditation Canada accredits to its standards, but those standards are not accreditation to ISO 15189 at this point. So some comments on accreditation. ISO 15189 is a national standard for accreditation because it's been adopted by the Standards Council of Canada. It's up to each province or territory to mandate ISO 15189 as a provincial requirement to become a requirement for accreditation in each province or territory. Because laboratory quality is largely a provincial responsibility, there are no national requirements across Canada for accreditation of clinical labs. And in the U.S., there is a consistent minimum requirement for medical laboratories through the CLIA Act of 1988. Okay, I would, so how does accreditation improve quality? Implementation of a quality management system provides a solid foundation for quality in the laboratory, and all of the work required to meet the requirements does result in improvements in quality. So things laboratories have to do: they have to do document control, they have to do occurrence management or incident management, they have to do corrective and preventive action when they have occurrences or problems. They have to do internal audits in all of the areas of the laboratory. They have to have quality indicators and monitor these on an ongoing basis. You don't monitor them forever. When you find that you meet an indicator, you can change it to something else. You have to assess customer satisfaction. You have to do management review of the entire quality management system. So all of these activities, if you do all of this work, your quality in the lab is improving. So what are the specific benefits of accreditation? Well, it requires the development of standardized processes which improve efficiency and generally reduce costs. It identifies areas that need improvement in the laboratory. It identifies risk issues that need to be addressed. It supports best practices. It contributes to building a culture of quality and safety in the laboratory, and it publicly promotes and recognizes the achievement of the laboratory. So I'd like to move on now to the importance of document control in maintaining quality. So these are some observations which perhaps are quite humorous in retrospect. On some small Ontario labs, when I was doing workshops on implementing laboratory accreditation requirements in 2003. So we had procedures on 5 1/4-inch floppies. Those were the big square ones. Computers no longer had such drives. We had procedures on corrupted 3 1/4-inch floppies. We had procedures on a Mac computer at home when the hospital was using PCs. We had lots of procedures that were hard copy only, so there was no electronic copy to be able to revise. We had procedures that hadn't been reviewed or revised in 10 to 15 years. And we had a lab that had one computer, the lab manager's computer. They had Word but not Excel, and the staff didn't have any access to PCs at all. Another kind of issue that we found was that there was duplication of material in numerous procedures, and that as soon as you have duplication of material, this tends to lead to conflicting information. We had incomplete and incorrect information, especially when procedures hadn't been updated for many years. And procedures sometimes were very long and wandering, overlapping with each other, whereas shorter and perhaps a larger number of procedures are easier to update and to control. So what is a document and what is document control? Well, a document is any information that provides direction. So it can be instructions, it can be textbooks, it can be reference intervals and their origins, procedures, and so on. So this actually means that if you refer to textbooks in your procedures, say for looking at slides in hematology or pathology or as part of the procedures, these actually have to be controlled documents. Document control is a system to regulate the handling and management of documents. This includes archiving, storing, and destruction of old ones, and documents that contain information that communicate policies, processes, procedures, as well as records. It usually pertains to documents that are part of a quality management system, such as is required by accreditation to ISO 15189. So documents that need to be controlled, and here we also have the document triangle: processes, policies, procedures, forms. Usually policies, there's rather few in number, which is why it's at the top end of the triangle. There are more processes, there are still more procedures, and there may be a larger number of forms as well. Now, just a note, forms are templates, and they need to be controlled. Populated or completed forms are records. So some of the requirements for document control in ISO 15189 are the following. There has to be procedures to control all documents, and this includes if they're in a computerized system. You have to have a document control log, so a list of all the documents that identifies current valid revisions and their distribution. There has to be a procedure to review, revise, and approve all documents. Only current authorized versions are to be available. This is often a sticky point at accreditation time, because if you post little sticky notes around your lab or tape up directions and it says, do this now, those are considered unauthorized and uncontrolled documents, and labs in Ontario regularly get dinged for having sticky notes telling staff what to do or pieces of paper taped up. Not allowed to have those. You have to remove obsolete documents from use and archive them and define the retention period. For handwritten amendments, they are allowed, but you have to define the authority, and changes must be clear, initialed, and dated, and they mustn't hang around for too long. You need to get on with it and revise that document. There needs to be unique identifiers for all documents, and there needs to be an authority for issue. So, for example, this is our header and our footer at Headwaters Healthcare Center. Unique identification, we have the title of the document and we have the document number. The facility name is here. We have the date of issue here. We have the edition and or the current revision date and or revision number. So here we have the revision number and the revision date. You have to have the total number of pages and the page in relation to that total number. And then the authority for issue is the laboratory director. We also have a footer on the documents that more or less says if you have a printed copy, it might not be the most recent one, and you should check the intranet for the most current document. So a document control system can be electronic or manual. In terms of electronic document control systems, there's many solutions available for document control software. However, at Headwaters, we're a small hospital and we have a manual system on a policy drive or intranet. And we organize, at my last count, it was 1,800 documents altogether. So this is the main structure of our policy drive. We have document templates. We have, I think, 4 document templates. We have lots of exhibits. We have lots of forms. Our quality manual consists of the policies and the process maps and of the quality management system procedures here. And then we have the technical procedures. And our technical procedures break out like that. And then each one may break out further. So this is how we control this on a manual system. It's quite possible to do. It's time consuming. It isn't always perfect, but it works. We're looking forward to when we might be getting document control software someday, but I don't know when that will be happening. So how document control contributes to quality? Well, the documents are current. They're available to the users either in paper form or on the computer system. They're approved by a proper authority. They are uniquely identified, so there should not be any confusion about which document someone needs to use. They're changed in a controlled manner, and they have to be reviewed every year. Now, this you may just very cursorily look at them and say these are all fine, or you may do detailed reviews, but they do have to be reviewed every year, so they can't be desperately out of date. So a document control system allows staff to find procedures, both hard copy and electronic. There's responsibilities of the staff are established. There's a document control log in place. Procedures usually have a consistency of style because they've been set up that way. They're easy to follow, and they don't have too much duplication because that's one of the points, is to not repeat information in documents. That can lead to error and waste of reading content when the procedure, that part of it is in several documents. Staff have to be trained, and so they should be performing procedures consistently. Having many procedures is, that's a problem in itself, but the procedures are easy to update because they're targeted, and you don't just have to update one part of a very long procedure frequently because there's changes to it. We try to keep them fairly short and to the point. They're easy to audit for doing internal audits. It's fairly easy to identify gaps in documentation and to fill in that gap when you find one because it fits in between usually something and something else. You have to make sure obsolete documents are not available to staff, but you also need to archive these for legal purposes and also for knowledge preservation. So, secrets to successful documentation. Write what you do what you write everything but just once. So this concludes my presentation. In summary, we've reviewed sources for laboratory quality management standards. We've reviewed the role of laboratory accreditation in improving quality, And we've discussed with a double D in it, sorry about that, the importance of document control in maintaining quality. So, do you have any questions?
Well, thank you. Can you hear, Lynn, can you hear me?
Yes, I can.
Okay, thank you, Lynn, for that excellent overview, this comprehensive overview on quality management systems. And so I'm inviting people now to either type their questions in through the chat box, or else, and we'll deal with those questions first. But the other option is to actually unmute your line. If you want to ask a question verbally, you can unmute your line by pressing star 7, and you can ask a question. And so I'll give the audience an opportunity to ask questions first. So does anyone have any questions? Please type them in or press star 7.
Morris, I have a question from Sherry Perkins.
Okay, good.
Can you recommend ways to control textbook software posters? For textbooks and posters, under our forms in our hierarchy of documents, we have exhibits. So exhibits are external documents that are supplied to us. They may be requisitions from other hospitals. They may be instrument manuals. In fact, often are instrument manuals or other ways of, the manufacturers telling us what to do with our equipment. And what we do is, according to that technical hierarchy, so BC for biochemistry, HE for hematology, we give each of these an exhibit number. So it would be exhibit BC-001, exhibit BC-002, and this is all part of the document control software. So your manual for your equipment might be exhibit BC-001. The textbook or the poster that supports something within your system might be BC-002, and so on and so forth. Software is another problem. I think maintaining a list of software, like a document control list, it would be a software control list with the various version numbers that you have. You can't really stick an exhibit number on a software document, but it would be maintaining an up-to-date document software log with the latest version, and say what day it was installed on the instrument and possibly what day it was removed when the next version is installed. That would be my suggestion there.
Well, thank you for answering that question. Do you see any other chat questions, Lynn?
No.
Okay, so anybody want to ask a question verbally, press star 7. If I don't hear anything, I will ask a question, but I'll give you a few more seconds. Okay, Lynn, you've been talking primarily about the lab accreditation itself. Now, one of the mysteries to me is instrument approval in Canada, or device approval in Canada. You have all these accrediting bodies and all these systems. For example, if a new diagnostic company wants to introduce a method or an instrument into this country, what bodies do they have to go to actually get approval to market their product?
This isn't something that I have looked into in any way, Morris, but they have to have the approval of accreditation of Health Canada.
That's what I thought. So you didn't mention Health Canada, so I was wondering how they fit into this.
They have to have the approval of Health Canada. Basically, it's like an FDA kind of approval, although, in fact, I don't know, in some cases it may have higher standards than FDA, but they do have to have Health Canada approval. How they get that, what is exactly their process and what kind of message they get that says their whatever is approved, I'm not aware of that.
Yeah, that's just why I was asking the question, but great, thank you. Thank you for that. The other thing, Lynn, this is you've mentioned this is part of a introductory. You're going to be starting up a quality program. Could you tell us more about that?
Come to the CSCC meeting in Montreal.
Okay, so you don't want to say anything at this point?
No, I'm going to. So, for example, Well, we're developing a certificate program in quality management for our members, and we are hoping that a lot of members will subscribe to this. It's going to be a very reasonable cost. We're developing 5 modules, and these 5 modules are laboratory quality management standards. So this talk that I've just given supports that module, and it will be available on the CSCC website for people that take the program but haven't been present today to hear. There's a module on analytical performance goals for laboratory tests. There's a module on control of nonconformities. There's a module on culture of quality and patient safety. And there's a module on ethics and risk management. Now, further to that, the module on culture of quality and patient safety, Jay Kalra is going to be giving an educational roundtable on May 14 at the same time period on that topic. And so if you are signed up, you will hear another talk that supports our program on the certificate in lab quality management. That was a very good lead-in, Morris. Thank you.
Okay. One other question. There are so many of these different bodies. Is there any way that some of these could be merged or communicate so to simplify the process, in your opinion?
I think it probably is more complicated than even I know. Well, I don't know. I mean, at the top of in terms of what we are concerned in the lab in Canada, at the top of the heap is Standards Council of Canada, but it has nothing to do with what our day-to-day activities are. Under it, there's a Canadian Standards Organization, which does impact because it produces standards that we use. I don't know that there will be much motivation to simplify systems either, Morris.
Okay. Because it seems like we're creating work for a lot. There's job opportunities for a lot of people because of all these bodies, and I'm wondering if it's over. But I understand from a lab perspective, we have our accreditation bodies that we have to relate to, and that should be most of what we should need to know. But it seems that they have to they have to communicate with all these other bodies to make sure that they're consistent.
Yes. And for example, the Canadian Standards Association, this committee on quality management that I am a member of, so within ISO, it's TC212 that revises all of these laboratory standards. So 15189, 15190, work on measurement uncertainty, all kinds of standards on reference methods and reference materials for manufacturers, and all kinds of standards on microbiology, and actually a new group on biogenetics, biomedical and genetic testing, and so on. So our CSA committee has a number of members, quite a number of members who are represented on ISO TC212 and its different work groups. So there's quite a scope there for involvement. In fact, Zolda, I believe, is involved in one of those work groups, and I think she's online today.
Well, thank you. Now, does anyone in the audience want to ask a question or type in a question? Please type them in now, or press *7 and ask a question. Lynn seems to know a lot about this, a lot more than I do. So.
Actually, I'm going to expand one more on Sherry's question, because what I forgot to say when I talked about assigning an exhibit number, for example, EXH BC-001, we put a sticker label on the particular paper copy. So if it's the textbook or the instrument manual of the manufacturer, we put that label on that document, on the hard version of that document. And we may have an electronic copy of it as well, but that part I forgot to say. Sorry, Sherry. Oh, there's a question from Benjamin Young. Thank you for the valuable talk, Lynn. I think you said that in Ontario, a lab may choose to get ISO 15189 accreditation or QMPLS. How does the lab decide? Oh, well, essentially, in IQMH is doing the accreditation visits. Our laboratory is not actually accredited to 15189 because we have the accreditation certificate for Ontario labs, or Ontario accreditation. To get the certificate to 15189, you have to contact IQMH. You have to pay an additional fee each year. I think it's of around $1,000 or $1,200. And you have to have an intermediate visit. So the peer assessment visits are at 4-year intervals. And in the middle, if you are doing accreditation to the Ontario requirements, you do a self-assessment. And you just have to submit an electronic document saying where you are with all of the requirements. If you are getting an accreditation certificate to ISO 15189, you have to have a site visit by, it would be perhaps 2 or 3 assessors, maybe 1 or 2 assessors, and it might be a 1-day visit. And essentially they are looking at whatever deficiencies you had on your previous assessment. And you have to pay for that in addition. So there's a fee to cover the cost of that accreditation visit. That's essentially the difference between the 2 certificates. I think maybe 30 to 40% of laboratories actually pay for this additional visit and are accredited fully to ISO 15189, and I think that number is increasing all the time. While there is the cost to that, there's also quite a savings in not having to do the self-assessment, so that is some incentive to get the full accreditation to ISO 15189. I hope that that's answered your question, Benjamin. Thank you, he says.
And we have about a couple of minutes to go, and so are there any other questions? Again, please type your question in the chat box or press *7. So I'll give you another 10 seconds, and then otherwise we will close this session. Okay, we will now wrap up. And again, thank you, Lynn, for that excellent overview on quality management systems. And for the audience out there, remember there's going to be another related topic in 2 weeks' time, given by Jay Calra. So talk to you next in a couple of weeks.
Thank you very much.
Bye.
Bye now.